Welcome back, folks, to Ask Sam. And some of the questions are pretty intense. This session, I don't want to scare anyone off, but we're going to go through some chemistry as to what's going on and also compare against some other drugs that are out there, and primarily prescription type drugs. But let's go ahead and get started with the first one. This is one that we get frequently, especially when it has to do with HER2 positive breast cancer. And I'm going to try to go through how ValAsta compares to Herceptin. Um, uh, Trastuzumab is the actual chemical name of the molecule. But the difference in these is the Herceptin inhibits the effects of overexpression of HER2. Now, what that means is that on cancer cells, there may be 10,000 times more HER2 receptors on the cancer cell. And the problem with that is that it stops, it just causes rapid growth. There's no apoptosis. And this allows the cancer cells to grow uncontrollably, really, and become immortal. So HER2 positive just means there's a huge number of these receptors on the cancer cell membrane as compared to normal cells. If the breast cancer is not HER2 positive, does not express a lot of these receptors, then Herceptin will probably not work. And you'll only get the side effects as a result of the chiral structure that we talked about earlier from the Herceptin. Only the left-handed molecule, I guess that would be left-handed on yours too. Only the left-handed molecule here actually would attach to the HER2 receptor. The right-hand molecule, which is something that is produced whenever we make anything in the lab, we make equal numbers of these. The right-hand molecule only causes side effects. So it's the inability of man to make in the organic lab only or selectively left-handed molecules. So in nature, when we eat something, this is why we have to eat food, we only, living things only have left-handed molecules. So natural supplements are by far giving you a more effective molecule than that which we could make in the laboratory. The other part of this, and I'm going to get my little laser going here. Now, when we compare it to ValAsta, ValAsta inhibits the C terminus of the amino acid by reacting with the OH functional group of the amino acid. Okay, take notes because there may be a test. ValAsta inhibits the C terminus of the amino acid by reacting with the hydroxyl functional group of the amino acid. Okay, I'm going to go through what all of that means here shortly. That's one mechanism that it stops the HER2 receptor. So if I got this receptor sticking up out of the cell membrane, looking for something to activate it, here are C terminus ends of the protein that make up that receptor. So when this molecule comes down, it reacts with it, sends an electric charge down and into the cell membrane, and it causes more activity in the cell. These are called C terminus, which means that the amino acid ends with a carboxylic or a carbon terminal end versus a nitrogen terminal end, and I'm going to show you those. So ValAsta, because it has a hydroxyl end, will react with the hydroxyl end of the carboxylic acid group and stick here. Now, when a molecule comes down, it cannot make contact. This receptor is now inhibited or tied up. Now, the other way that ValAsta works for HER2 negatives or any other cancer that is not PD-L1 expressed or has a receptor issue, ValAsta, through its glucosidic, which means it has a glucose attached to the astaxanthin. So this glucose molecule is loved by cancer, and it will get sucked into the cancer. And there's a reaction that happens internal to the cancer cell. Cancer cells produce huge concentrations of these hydroxyl free radicals having a zero charge. They're essentially electrically neutral. They are short one electron in a pair of electrons orbiting this thing. So when this is called a conjugate acid, when this is inside and produced by the cancer cells, the pH drops to less than 7. When the pH drops less than 7, the insides and the exterior, the exogenous side of the cancer cell will become acidic. Anything from 0 to 7 is acidic. Anything from 7 to 14 is alkaline. Now, the way that the astaxanthin, because it has such a high concentration of free electrons, it can donate a free electron without itself becoming a free radical. That's what makes it so unique. Unlike vitamin C will become a free radical and will add to an inflammatory condition at high doses. So the reaction is, once the OH zero charge accepts an electron from the ValAsta, it becomes an OH minus 1. That's called a hydroxyl ion. And the hydroxyl ion immediately shoots the pH inside the alkaline, inside the cancer cell from a acid pH of less than 7 to well over 10, which is an alkaline pH, and it kills the cancer cell within seconds. It's not something that the cancer cell can tolerate. Now we're going to get into what I'm implying here about C-terminus and N-terminus amino acids. So this is one amino acid. An amino acid is something that has a carboxylic acid group on one end and an alkaline nitrogen functional group on the other. Acid, base, all on one molecule. This R group can be a huge extension of organic molecules, and I'll show you what some of those might be. But these are the two reactive N groups of an amino acid. This carboxylic acid group will react with this is acid, will react with the base end of another amino acid, and they'll combine. And they become a dimer or a peptide of two molecules. These are monomers, which means mono means one, mer means unit. So you have a monomer, a monomer. They react and they form a dimer, or two units. But you see, it still retains an alkaline end group and a carboxyl terminus end. This thing will keep growing until you have 10,000 of these units attached, and it looks, the best analogy is a string of spaghetti. So you start out with a tiny little piece of dough, or a pearl necklace, for example. You just keep adding pearls to it. This is a polymer, or a plastic, by definition. And so really all we are is soap bubbles, phospholipid membranes around the cells, and plastic, or polymers. The length of this and the functionality of this R group dictates the activity of that protein. Could be insulin, could be a steroid, could be something else. Over here we have dipeptides. This is the actual reaction. Here we have glycine reacting with alanine, So the byproduct is always water, by the way. So these two would react, and you end up with a dipeptide, two molecules of glycyl and alanine plus water. So there's your organic chemistry lesson for the evening. But keep in mind that these functional groups, the carboxylic acid group and the amino group, will react together. But not only that, this OH can react with other molecules, for example, glucose, and it will form a glucosidic bond. And that's how we make ValAsta. Here is Herceptin. It's a monoclonal antibody. It's very, very interesting molecule. All antibodies have this Y shape to it. And the reason is because these fit into the receptor very, very snugly. Now, on this here you have the nitrogen terminus ends, but down here you have the carbon terminus ends. In this case here, this group is going to attach to the carboxylic end group sticking up from the receptor, the HER2 receptor. It's going to stick to it and block it or inhibit it. So this structure here is going to be dangling off of that receptor so that the estrogen molecule cannot make contact in that receptor, and it will turn off that receptor. Here are the 20, actually 22 amino acids, but these are the top 20. One thing I want you to look at this very, very carefully and look at the commonality of it. What do they all have in common? They all have in common the carboxylic end group and the amine group. These other things attached to it just dictate the type of protein that's being generated by the DNA. DNA just attaches these molecules to these amino acids. For example, here's tryptophan. This is one that makes you sleepy after you eat turkey. The end group of the PD-L1 and also the HER2 positive receptor is tyrosine. This is the reactive site here. All of these are basically the same. If you were taking a class, you'd have to have all these memorized with molecular weights and know what their pKa's are. For example, these pKa's are similar to pH. Okay, here's one here, pKa of 2.34. Glycine acts like an acid. Here's one that another acid, 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 acid. Alkaline. It's a pKa of 10.47. 9, alkaline. 8.73, alkaline. 9.54. All the way down through here. These are typically alkaline based. And the alkalinity is coming from the NH2 functionality of these molecules. So I hope that helps describe what it is when we talk about receptors and how those receptors are inhibited. There's targeted molecules. PD-L1 is one that we focus on routinely. There's a new molecule Sloan Kettering just came out with on immunotherapy. It's a monoclonal antibody. It's got 100% out of 14 patients of colorectal cancer, 13. It now has a 100% cure rate over several months. We're on the right track here. We've been saying for 3 years that this is a PD-L1 or a receptor solution. Tyrosine is probably the key, this molecule right here. This appears to be the end group of most of these receptors. So what targets that? Will shut down the ability of the cancer cell to communicate, and it puts pressure on the cancer cell, usually leads to apoptotic type of a death or a necrotic type of death. Here's some of the questions. Sarah W. says, I'm recovering from ER/PR positive, HER2 positive breast cancer with bone metastasis. Started taking ValAsta on 26th of May orally, and on June 2nd, by salve on my breast. I have watched your in-depth and greatly informative videos with regarding tumor size and then the increased mass at sites because of dead cancer cells after starting ValAsta. I am experiencing much increasing pain at the bone metastasis sites and a few new places as well since beginning to use ValAsta. I would like to have more clarity regarding the increase in pain. Could it be due to what happens to the size of the material? I understand it's probably not tumor material, but dead material at the bone metastasis sites. We get several of these inquiries after taking ValAsta. And I'm going to go through something here. These are called lytic lesions. And I'm going to show a graphic here. The picture on the left is a post autopsy of the bone that had cancer in it. Prostate cancer does this. Some ovarian cancers will do this. You can see the pits in the bone. When we look at the X-ray, we can see some of these lytic lesions. Here's one right here that corresponds to, I believe, that one right there. There's another one right here, corresponds to this. This large gap and fracture up through this joint corresponds to this up through here. So it takes a trained eye to be able to read the X-rays and see what's going on here. This one, at this point, you can see a hole there. That's this hole here. Now, when you have metastases into the bone, the cancer is living in these pockets. And that dissolved bone usually shows up as alkaline phosphatase in the bloodstream. So you always want to measure your alkaline phosphatase. And in most cancer cases, the alkaline phosphatase number will be high, indicating the cancer is eating the bone away, and it's raising the calcium phosphate levels in the bloodstream. Once your alkaline phosphatase levels begin to drop, it's a pretty good indicator that the cancer is no longer active in the bone. There's no more bone being dissolved. The cancer is probably dying. When the cancer dies, it leaves these pockets. These pockets will fill with fluid and cause tremendous pain until they fill in. That could take several months once it gets to this point. But when these begin to fill in, the only way they can fill in is through an inflammatory response to cause a rebuilding of the calcium to repair that bone. It's like having a bone break, and it takes time. It could take several months, at least 8 weeks. But that's where the pain is coming from. It can be pretty severe because there's nerve endings. There's a lot of inflammation happening here. There's fluids being deposited and swelling. So this is a pretty severe case here. Here's one of the vertebrae. This happens in prostate cancer and also some inflammatory breast cancers. This is just an X-ray of the vertebrae itself. But here you can see the lytic lesions all through the vertebrae. And where the nerves come out, here and here, out from the spine, these can cause even fragments and flaking off of the bone material and impinge on these nerves. So you can get, this is up pretty high. This is L1, L2, about mid-level across. This seems to be where a lot of the breast cancer attack happens. You can't get down into L3 and L4, but these give you that sharp pain that wraps around your ribs, comes around, shoots down into towards your belly button, into your pelvic area. L3 is more in the pelvic area, but that's where that pain is coming from. And I hope that this is helpful in understanding that once the cancer begins to die and these pits begin to form, there's nothing to fill them once the cancer cells die. It's actually a good thing if you can tolerate the pain. And the pain management could go on for several months. Good question, by the way, and it comes up frequently. When people get that much pain, when the ValAsta kicks in, your CA numbers will, or CEA numbers will drop off. Your alkaline phosphatase will drop off. Your CA numbers may increase, and I'm going to talk about that also. And then the pain sets in. And that's when people get really concerned that they're dying or there's something really bad happening because the pain level gets so high. This is what's causing that pain. And it's not all bad news. It's just painful. Ursa. This one's fairly lengthy, but he's got some good points here. It says, I noticed all those prostate cancer patients writing to you are saying after starting with ValAsta, their PSA has gone down from 10 or 12 down to 4 and 5. I've noticed, I haven't noticed anyone saying his PSA is or was 550, like I have, such that it could give me an idea if and how ValAsta could help me after a certain period of time. My PSA is steadily rising since 2011. Over the last 9 months, I lost almost 20 kilograms. I am left with skin and bones. What should I do to lower my PSA level? ValAsta will bring down your PSA level. This number, it's like boxing with a giant. The taller they are, the harder they fall. So this is something that you're going to see a very, very dramatic drop. I'd be very interested in seeing what your alkaline phosphatase is, and if the cancer has moved into your bones, and because that's the long-term healing process I was just talking about before. It continues, possibly because of depleted muscles and connective tissue, skeletal tissue, I developed 2 hernias which are very painful. Would ValAsta or anything that you could recommend me help to rebuild them to keep my guts in their places, or should I go and get them surgically repaired? Surgery is the best option. ValAsta is not going to do anything with healing a hernia or putting together the parts that have been separated. Surgery is probably the best option that I could think of. It says, what can I do to help to start shrinking my prostate to enable me to drain my bladder under my control? Will I ever be able to do without catheter eventually, and roughly how long before it can happen? What are the effects of ValAsta on various hormones related to prostate cancer? ValAsta to date has had, and I've talked about this before also, doesn't have really any effect on the hormone structure as it relates to prostate cancer. Once the cancer starts to go into necrosis, your prostate tissue normally will reduce in size. If there's a lot of scarring there, you're going to have your doctor take a look at it. So I can't really answer that with this question here. Sorry about that, but it's not in my wheelhouse to really figure that out. The prostate cancer itself would probably reduce in size, which would have a very positive effect on your ability to urinate. Dr. Eric Berg and many cancer survivors are talking about the benefits of the prolonged fasting, such as 21 days. I'm not a big proponent of long-term fasting. Usually, if someone's ill, keeping nutrition up is a lot more important. I don't know what fasting gains you other than it will shock your system, and you might activate something more positive. For example, sugar uptake rates, reduced insulin resistance. But if I suggest nothing over a 2-day fast, that's it. Especially if you're dealing with cancer or an inflammatory disease, cutting your nutrition is not positive. Fasting has some psychological benefits. It does cause your pancreas to rest. It causes your liver to rest, and it can make your metabolic process more efficient. What would you like to say about fasting? Should I try both ValAsta and fasting? You can. The idea of ValAsta, I think that's probably the next question here. Can I take ValAsta or any other supplements on empty stomach? Yes, you can. There's not going to be a lot of discharge at that point, but the discharge that you will have in your stool will be red, and so you can take it on an empty stomach. It's already very liposomal. It's already in the oil, so it will make it into your duodenum or duodenum, however you want to say it, and it will be absorbed very, very readily. Now, if you're fasting, your body is going to be looking to absorb anything that enters your stomach very, very quickly. I don't have any data to suggest that fasting accelerates the absorption of ValAsta. I could put together an argument that it would probably enhance it simply because of the starvation mechanism that kicks in when you fast. But I don't have any evidence of that. Could you please make any suggestions, advice on how to unchoke or unblock the region around my prostate, if any blockage? The only solution that I know is to eliminate the blockage. And if it's inflammatory, ValAsta will help tremendously, and you should notice the difference in as little as a week. Number 9, finally, I've been suffering from tinnitus and deteriorating eyesight. Could ValAsta help any of these conditions? Absolutely. If tinnitus is an inflammatory derived illness, absolutely. Deteriorating eyesight, if it's from macular degeneration or glaucoma, both of those are inflammatory, and ValAsta will have a very positive effect on those. Amy M. I recently learned of your product and had 4 questions. I'm following a keto lifestyle to try to manage my T2D. Are there carbohydrates in ValAsta? If so, how many total grams so I can count for them in my daily carb account? We do react glucose to the astaxanthin, but it is a molecule. It's equivalent to about 4 milligrams per serving, 4 thousandths of a gram. So it's probably de minimis. It's probably not worrying about as far as a carbohydrate count. There's more carbohydrates in the meat you're eating than there is probably most assuredly in the ValAsta that you would take. I'm being treated for possible bladder issues, not emptying. Is there any possible connection that ValAsta has to that? None that I know of. I don't have any reason to suspect that ValAsta would do that. There could be a secondary. Have you had any trouble with kidney stones in the past? So I would venture a guess that there's something else secondarily that's causing that problem. Any effects on the thyroid? I'm hypothyroid. Right thyroid gland removed in 1994 due to a goiter. If you're hypothyroid, then you're probably on medication at this point. It's not inflammatory. It's been surgically removed. It's mechanical. So I'm not sure that ValAsta would have any effect on the thyroid that at this point. Now, if your left thyroid gland is inflamed, then ValAsta would definitely help there. It would be worth a try. There's no downside to ValAsta that we know of at this point. So it's worth a try. You'll know within 30 days. Lastly, I know you mentioned psoriatic arthritis. Does ValAsta help with regular psoriasis? Absolutely. The interesting thing with psoriasis, dermal psoriasis, is that you can attack it both orally and topically. So you can take the ValAsta oil or the salve that contains ValAsta and put it directly on the psoriasis, and also take it orally, which will bring it in from the underside into the epidermis and dermis. And we've seen some pretty dramatic effects of that. Billy B, what are some things that affect absorption of ValAsta? Any food, supplements? We have to just get it past the stomach. So any oil-based foods are really good. The ValAsta itself is glucosidic, which means it has sugar, but it is also contained within the liposomal oil droplet. So it's very well protected until it gets into the small bowel, and the pH is changed from that of acid in your stomach to alkaline in your small bowel due to bile being introduced into the duodenum. April says, can ValAsta help with our skin, hair, for wrinkles, dark spots, hair growth? And what about losing weight? Does taking more get better and faster results? Very, very good question. ValAsta stops the formation of what's called hydroxytestosterone. Hydroxytestosterone is the molecule that causes hair loss. In women, your hair will grow back. In men, it doesn't. So, or maybe that's why I still have some hair, some left anyways. But in women, their hair comes back. So we see women who are under tremendous stressed conditions. They'll have bald patches. Those bald patches come back after they've been on ValAsta for about 30 to 60 days. They'll start noticing that their hair is growing back. And the reason that happens is because of the hydroxytestosterone levels. Hydroxytestosterone is made when the testosterone molecule reacts with a hydroxyl free radical, and they stick and they form a chemical called hydroxytestosterone. Hydroxytestosterone will plate out in the hair follicles, and it will kill the hair follicle. In women, it doesn't seem to be permanent. So once we reverse the stress condition, then, and with ValAsta to neutralize the hydroxyl formation, then the hair will start to grow back. What about losing weight? Another very good question. Most people who are taking ValAsta do lose weight. The reason is because of what's called insulin resistance. You're more efficiently using your insulin. When you have insulin resistance, again, the hydroxyl free radical will cause a misfolding of the insulin protein. So instead of the insulin coming down and to fit snugly into the insulin receptor, the insulin protein itself makes contact with a hydroxyl free radical, and it does this. It opens up. Now it can't get into the receptor to make contact. So if that insulin receptor can't make contact with insulin, there's no signal that goes down to the glucose channels in the cell membrane to open up. The only way that sugar can flow from your bloodstream into the cell is if the glucose channels open up. So if the insulin is inhibited or misfolded, you can't make that contact. That's called type 2 diabetes. So any sugar that's floating around in your bloodstream has to go somewhere. Your blood sugar levels will increase, and then your body, your liver, will start converting it into glycogen or fat. and triglycerides and cholesterol, and it'll store it, because all of that energy in sugar, there's 4 calories of energy per gram in sugar. There's 9 calories per gram of fat. So for the same gram, we're much more efficient storing it as fat than we are trying to store it as a carbohydrate. So our bodies convert it into fat. For example, I would probably weigh about 400 pounds if all of the energy that I did not burn was converted into sugar or carbohydrates and stored as carbohydrates. But we store it as fat. So getting back to your question, how do you lose weight? You lose weight because the insulin is not going to be misfolded. Your insulin is going to be more efficiently utilized. The receptor, the insulin is going to fit into the receptor now instead of being a flat piece of paper trying to get in there. Now it's going to fit. Glucose channels are going to open. Sugar is going to flow from your bloodstream into the cells. Your cells are going to tell your brain, I'm fat, dumb, and happy. You don't have to eat anything. Whereas if the glucose channels stay closed, your cells will release a chemical compound called leptin that will immediately go to the brain and tell the brain, you need to eat 20 Snicker bars right now. I got to raise the sugar level, the concentration in the bloodstream, to force it into the cells because the cells are starving. That's how it works. And there's entire courses taught on this, but that's it. So if you're more efficiently using your insulin, you will lose weight. ValAsta allows that insulin to be more efficiently used. Also, be very, very careful what you're eating. Fructose is, again, that's my pet peeve, but fructose is one of those that causes insulin resistance. It also causes severe pancreatic inflammation and is probably, don't know this for a fact yet, but we're getting very close. It's probably the leading cause of pancreatic cancer and non-alcoholic cirrhosis of the liver. Does taking more get better and faster results? That's a chemistry course, and I could mathematically show you why that in fact is true. I talked about it last week, a little bit about Gibbs free energy, but typically it's called the dose response curve. As I increase the dose, the response should happen, should follow that. So they should move together. Vitamin C is a good example, though. As I keep increasing the dose of vitamin C, the antioxidant effect goes up and my inflammation goes down. As I continue to increase the vitamin C dose, my inflammatory state will get worse. It will bend over. That's what causes a lot of this, where people think more is better. It may not be the case at all. With ValAsta at this point, because we have no side effects, it is not a pro-oxidant, unlike vitamin C is a pro-oxidant, which means that it causes an inflammatory response. ValAsta causes no inflammatory response as we go up in dose. So to answer your question, we are seeing a lot of cases now where people are arbitrarily increasing their dose and their responses are phenomenal. So there is a biochemical reason for that. There's no downside to ValAsta. We don't get into the inverse of the dose response relationship. So it is something that I just don't have enough information on it. We're probably at the highest dose that we've seen now, but the results are still astounding. We are right on as to what causes most of these inflammatory diseases, and now we know how to stop them. So we're that close to stopping inflammatory disease and actually preventing it. And this leads us into one here, Paul M. With the onset of Parkinson's, I started doing a lot of research about natural products to help. What I found was lion's mane mushrooms. Is there a contraindication? Taking the mushrooms with and ValAsta. I'm taking both at this time, and I'm looking for something that will eventually heal. The active ingredients, this took me a while to do this, but I've been able to find the primary antioxidant molecules found in lion's mane mushrooms. It turns out these same antioxidants are found in other mushrooms. So there is some antioxidant, quite a bit of antioxidant capacity within these mushrooms. Now, it looks very similar. Look at these conjugated double bonds here, here. Look at all the OHs up here. Here, look at all these OHs. Here's the carboxylic acid group, OH, OH, OH. These are all active functional groups. They help stabilize when this molecule here, let's just pick this one here. There's an extra several electrons here that this molecule could donate to eradicate a free radical. The problem is when a molecule donates an electron, usually itself would become a free radical. But the way these are structured, these got this long tail. This is called a resonating molecule. It will resonate. So even though it's missing an electron that it donated to a hydroxyl free radical, and it's short an electron, these electrons will float and fill where the imbalance occurs, and this molecule will not even blink in being that molecule. It will remain that molecule. So itself will not become a free radical. Same with this. You have a lot of resonance capacity inside these molecules. So this thing can donate an electron, and the instability of the other electron that's looking for its buddy can just resonate back and forth, but it remains stable. It may find another electron, but it will remain stable. So bottom line is, in these lion's mane mushrooms and some of the mushrooms that we eat, these intense natural antioxidants are there. They're not equivalent to astaxanthin. Astaxanthin has an ORAC score, an oxygen radical absorption coefficient of about 2.2 million. These are going to have antioxidant ORAC scores in probably 1/10 that, maybe 10,000, or I'm sorry, 200,000 on an ORAC score. They're not going to be as intense, but they do appear biochemically to have the ability to resonate and bounce electrons up and down this chain without itself becoming a free radical. I know that's complicated, but if it were me, and the more antioxidants you add, even though the ValAsta is going to be 10 times more powerful than this, there's nothing here that I would see that would cause any sort of harm, as there are with some other poisonous mushrooms, but there's nothing here that in this molecule. Alicia W. Been taking 6 to 8 ValAsta for 3 to 4 months. My stools are not only extremely red, but very loose and very frequent. Also, I'm starting to notice unwanted weight loss. Please address this also. It says if I've been taking 6 to 8 ValAsta. I don't know whether that's 6 to 8 pills, 6 to 8 pumps. If it's pumps and your body weight is 150 or 75 kilos or less, That's still quite a bit. You're probably saturated at this point, so you could cut that dose back at least 20%. The extreme red after 3 or 4 months indicates that your body's saturated currently. You're probably very well protected. If you're, and it does look like it's the oil, it could be the olive oil that's in the capsules, also has a lubricating effect. If you're doing any sort of sugar drinks, that's going to have a pretty tough, that's going to be tough on your system also. There's certain foods like potato chips, pretzels, high carbs. They all contain fairly high levels of fructose. So be very, very careful. And if you have a yeast, and we all do, yeast growing in our colon, it's going to take that fructose and it's going to ferment it. It doesn't, unfortunately, ferment it into alcohol, but it does ferment it back into the aldehydes and CO2 gas, and it can cause a pretty severe inflammatory response. She also asks, would there be any reason to not take chlorella while taking ValAsta? Not at all. Chlorella is a phytoxanthin, very healthy. Chlorella itself has all the micronutrients in it for survival. If you just lived off of 2,000 calories a day of chlorella, you would live a normal life. That's how nutritious some of these algae species are. There's spirulina, chlorella, oleoabundans, Haematococcus is another one that we get the astaxanthin from. There's over 3,000 species of algae. Some are poisonous, but they all contain the perfect micronutrient balance for survival. That's why it's such a fundamental food supply. And Jim Mac, my wife has decided to get off of Lexapro, 20 milligrams. Any suggestions how you do this while taking astaxanthin on a daily basis? Suggestions on the internet do not take into consideration person taking ValAsta daily. The ValAsta won't have any impact on this at all. I went through and I drew up some of the symptoms that she may experience going off of Lexapro, but I would at least tell your doctor that you're looking to wean off of Lexapro. It can mess with your emotions quite a bit. Just be aware that these could all be the dizziness, the confusion, the lack of concentration, crying uncontrollably. These can all be symptoms of coming off of Lexapro. My mother has been taking ValAsta for 30 days. During that time, she was getting high-dose vitamin C treatments, curcumin, low-dose chemotherapy, and other natural therapies for stage 4 metastatic rectal cancer. By the way, she probably needs to get a hold of Sloan Kettering. She might be a candidate for the new immunotherapy drug they have there. She has visible tumors on her abdomen area. She also developed lymph nodes under her armpits. I know she needs more time with the ValAsta to see results, but her oncologist started her on chemo today, June the 13th. And the drugs she's getting are leucovorin, fluorouracil, that's like 5-FU, irinotecan. My mom was diagnosed in August of 2021. Her cancer only got worse with chemotherapy. That's why her oncologist wants to try immunotherapy targeted therapy. Absolutely. The drugs that end in MAB, M-A-B, these are PD-1 or PD-L1 targeted chemo drugs. They seem to work very well on colorectal cancers. So I would highly recommend that. the ValAsta does the same thing. So using these two in conjunction would have a very, very positive effect on her outcome. I just want to know, how will ValAsta work with chemotherapy drugs she is getting? Is there anything we can do to make it work better? Not really. I would not stop the ValAsta. In most cases, we find that there's a synergistic effect between chemo and the immunotherapy drugs and ValAsta, like Keytruda, Opdivo, Yervoy. They all work the same way. In the real intense chemo cocktails, they work against each other. And that's a problem that I have with the heavy dose chemo drugs that create an inflammatory response, because they'll offset some of the advantages of ValAsta. In one of the videos, Sam explains how you need to have a strong enough immune system, white blood cell count, to clean the cancer, and if the cancer is dead from the ValAsta. What can she do to keep her immune system up during chemotherapy while using with ValAsta? If she's taking heavy chemo, you'll notice her white blood cell count will go down, her platelet levels will probably drop. This is all resulting from bone marrow or spleen inflammation. This is why chemo is such a tough therapy, because they take you to a very tight edge of balance between killing all the cancer cells before the treatment harms you. Immunotherapy doesn't seem to behave that way. There is some chirality issues with the chemical made or the biolab produced immunotherapy drugs. But ValAsta, since it's only left-handed, it only has the single isomer, or enantiomer is what it's called, but it's all left-handed molecule. We don't have those side effects with ValAsta. She is currently taking medicinal mushrooms like turkey tail to keep her WBC up. She also wants me to recommend, or wants to know, and if I would recommend vitamin C infusion. I'm not a big proponent of vitamin C infusions. The simple fact is that you can get over and create a more inflammatory response in the liver. Vitamin C has to be taken out through the liver or through the kidneys. In either case, it'll have a tendency to cause a pretty severe inflammatory response. I hope that I've answered all of these. Please keep them coming in, and we're going to try to group them now. I have a little team set up where we can group them and try to cover, in general, the same topics as they come in. But once again, I want to thank you all for these. These are very good questions. I'm sorry about the chemistry lesson, but it's in some people that really sparks an interest. So keep them coming in to AskSam at ValAsta.net, and we'll do it again next week. Thank you very much.